So what I've got today are the top 10 symptoms that your GP will want to know about that might mean you have cancer. Now these symptoms if you have these symptoms, it doesn't necessarily mean you have cancer, but these are the sort of things that will make you want to investigate you and think about you with a possibility of cancer. So the first one is weight loss. So this is unexpected weight loss that you can't explain, and if that's happening over a few week period, we'd want to know about it. The second one is blood in your wee. We call that hematuria, and that can be a sign of kidney cancer or bladder cancer. And even if you just have blood in your wee once, it may be just an infection, but it can be a sign of cancer. We'd want to know about that. Number 3 is rectal bleeding, blood in your poo. If you've got new rectal bleeding that you haven't had before, we'd want to know about that. We'd want to decide how best to deal with it. It might just be piles, but let us think about how best to deal with you. The fourth one is a change of bowel habit. So this would mean if your poo has gone from being a normal consistency to very loose or to constipated over a period of a few weeks. Again, an infection can cause this, but if it lasts for a few weeks, that can be a sign of cancer. Number 5 is a breast lump, and I'm pleased to say patients are already coming to me with breast lumps despite the lockdown. But if you do have a breast lump, don't keep it to yourself. Tell us about it. We can organise for you to have the appropriate investigations. Number 6 is difficulty swallowing. So if you're eating food and it's getting stuck as it goes down, that's a worrying symptom. We want to know about that again to organise the appropriate investigations. Number 7 is a lump in your neck with no signs of infection. So sometimes people get lymph nodes in their necks if they have a sore throat or ears, but if you've got a lump in your neck that's not going away, or if you've got one that you can't say is due to an infection, get in touch with us. Again, we can look into that for you. Number 8 is for ladies after the menopause. If they have any vaginal bleeding, that can be a sign of endometrial cancer, womb cancer, and we'd want to know about that to organise the correct pathway for you. Number 9 is to do with skin lesions. So a melanoma is a skin lesion where you have a dark brown or black skin lesion that's enlarging, it's itchy or bleeding. And if you have a dark lesion like that, we'd want to know about it. Also, certain types of discharging lesions or moist lesions can be concerning. We have the option to do teledermatology, send photos of those to specialists, so let us know about that. The 10th one is probably the most complicated because that's cough. So of course with coronavirus people are having more cough, but cough can also be a sign of lung cancer, and we're worried that people aren't coming forward with potential lung cancer because cough has been put down to coronavirus. If you have a viral infection, that will give you a temperature. So if you're having a cough that you can't explain and it's going on, and it's not related to that sort of fever and loss of sense of taste or smell, get in touch with us because again we can organise appropriate investigations for you. So please remember, your GP surgeries are still open. They may be working differently to how they used to before, but we're here for you. We're still talking to patients, we're still seeing patients, and we're referring patients as needed. Look after yourselves, stay inside if you've been told to, and shield if you've been told to. But remember, we're available for you. Get in touch if you need to.